Friends, I am Dr. Surajit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 8 Homeo-Remedies for Ovaritis or Oophoritis. What is Ovaritis? We all have ideas about two ovaries in reproductive systems of women attached to endpoints of two fallopian tubes of uterus. Photograph or images on the right hand top. When one or both ovaries get inflamed along with peritoneal covering, the resultant ailment is called ovaritis. Look that this is uterus, fallopian tubes, both end ovary. This ovary is inflamed, so it is called ovaritis. This is a diagram drawn by some artist. This is the real picture. See, this is the real. This side is inflamed. This is uterus. This is ovary. This is inflammation, and it is covered with peritoneum, so it is glistening, and it is an original picture. What are the causes of ovaritis? So many causes. Sexually transmitted infections, STIs, it's called short STIs like chlamydia, gonorrhea, CLAP are commonest. IUD, intrauterine device inserted in incorrectly. Generally, modern medicine, that is gynecologist of modern medicine, insert some instrument inside the uterus. If that is done incorrectly, ovaritis may result. During abortion, childbirth, during miscarriage, catching severe cold during menstruation, coition during menstruation, from masturbation, injury or PID, pelvic inflammatory disease. Some pelvic inflammatory disease is a very big term. It's a gross inflammation of the abdominal organs, lower abdominal organs. Maybe from some type of PID, the infection is received by ovary and it gets inflamed. It's possible in cancer also. There are a few reasons with diagrams. What are the types of ovaritis? Types. One is plain ovaritis, means simple ovaritis. Another is autoimmune ovaritis. Here cells of immune system attack ovary, very much difficult to cure. Primary ovarian insufficiency, in modern medicine it is called. It is a resultant of primary ovarian insufficiency. This type of ovaritis is very difficult to be cured by modern medicine, but in homeopathy it is quite possible, because we go by symptoms and disease nature. Since it is autoimmune, we have to find out what causes this autoimmunity, that is deformity in the immune system. We have to find out that thing first, and it can be easily extracted from the history of the patient, how his immune system has been deformed. If there is no deformation of immune system, no autoimmune disease results. It is there. We have to find it, and generally we find it and treat it, and this is cured by doctors like who prefer this Hahnemannian or classical homeopathy, not ordinary homeopathy. It is not possible by ordinary homeopath. This is two types of ovaritis: simple ovaritis and autoimmune ovaritis. And every ovaritis have got two types: acute, generally subside within 7-8 days, and chronic. Now, what are the signs, symptoms of ovaritis? Pain, tenderness in lower abdomen, pelvis, intermenstrual bleeding, bleeding during sexual intercourse, profuse vaginal discharge with foul odor, burning and pain during micturition, dysuria, that is painful urination, repeated urge to pass urine, painful defecation, that is difficulty in passing stool also, fever, nausea, vomiting, swelling of abdomen, appetite loss, restlessness, pain in hip bone and groin. That is a very serious symptom. And once this symptom starts, it is sure that the disease has reached chronic stage. This is not generally seen in acute stage. A few symptoms of ovaritis has been picturized. What are complications of ovaritis? There are so many complications: leukorrhea, mastitis, pelvic inflammatory diseases. You see, I have noted a reason as pelvic inflammatory disease for ovaritis. From ovaritis also PID may cause. When ovaritis goes days and days, months and months, this may cause general inflammation of the pelvic region and cause pelvic inflammatory diseases. Ectopic pregnancy. Ectopic pregnancy, please note, ectopic pregnancy means pregnancy not in the ordinary place. We know that pregnancy, the baby develops within the womb. This is the womb. This is the space within the uterus. But sometimes this ovum doesn't get implanted in the ovarian void region. It implanted elsewhere, sometimes in the fallopian tube, sometimes in the body of the uterus. These are called ectopic pregnancy. See, the pregnancy will be developed within the fallopian tube or within the musculature of uterus, and so painful. It's a so painful disease. Sometimes it's also developed near ovary. Near ovary, the implantation of the fertilized ova has been done, and the baby start growing there. These are called ectopic pregnancy. It's a very painful disease. Abscess formation, sepsis, scar tissue formation. This is a scar tissue formation within the fallopian tube. So here also fallopian tube is inflamed. The salpingo of Oophoritis. It is both inflammation is there. Inflammation of this fallopian tube as well as this ovary. These are called salpingo Oophoritis. Anyway, this scar tissue formation may be also in the ovary itself. Scar tissue formation, and finally infertility. That is, the particular lady will not be able to bear child. How to manage a case of ovaritis? Acute cases: bed rest, coition completely prohibited, hot fomentation in abdomen, light diet like sago with milk, Horlicks, fruit juice, etc. Remedies as per signs symptoms. Chronic cases: strict hygiene around genital organs. You know, a lot of ladies use various types of fragrance, that is liquid with highly beautiful fragrance around their genitals. This is very dangerous, mind it. Doctors, I mean doctor means scientist doctors, including gynecologists, obstetrics, they have always suggested that the genital region should be washed with plain water. With plain water, at best with saline water, slightly warm. Nothing else. Nothing else. There are so many things available in the market saying that this pH should be better than that pH. Very scientific term they are using, and many of the ladies are overwhelmed with these scientific terms. pH, what is pH? These are just what should I call? These are just jargons to attract young patients. You simply wash your genital region with water, and water, nothing but water. At best, warm water, saline water, that is 0.1% saline, salt in 100 ml, 0.1 gram salt with 100 grams of water. At best, you use water, plain water, that's all. You need not do any beautiful things to wash around your genital organs. Remedy as per totality of symptom. In case of chronic disease, you must go for totality. Now, this here I have given some symptoms of acute ovaritis. Aconite. Causation: checked perspiration, sudden checked menses, fright, riding in cold winds, getting wet when overheated. Fear that she won't be cured, bitter vomiting, cold sweat, painful urging to urinate. These are the combination of symptoms for aconite. And you will certainly use this in 30 or 6 forms. This is in acute position that will do either 6 or 30 potency. If it is 6, then you give it say 6 times a day. If it is 30, 4 times a day. Generally it is subside within 2 or 3 days. Aloe for ovaritis: labor-like pain in groins and loins, fullness, heaviness in the abdomen, worse when standing. Entim-crude for ovaritis: menses checked by a bath. Nymphomania: nymphomania means excessive sexual urge. Tenderness over ovarian region, worse from touch. Arnica from ovaritis: affection of mechanical injuries. Affection from mechanical injuries to uterus or ovary. Pain as from a sprain in uterine region, obliging her to walk bent. He is walking in bent position. Now a few medicine for chronic cases. Cocculus for ovaritis: as menses appear, cutting, cramping pain, particularly in region of uterus and ovaries. Menses stopped. In exchange, cramp deep in abdomen. Pressure feeling in chest, anxiety, shivering over mammae. You can call this shivering in mammae as an USP, uncommon, strange, peculiar symptom. The problem is going on in the ovary and patient feels shivering in the mammae. So this is an exceptional symptom, and all exceptional symptoms are called USP, uncommon, strange, peculiar, and one symptom can select this particular medicine. Maybe some patient reports that, sir, I am suffering from severe abdominal pain. Doctors already have consulted some expert gynecologists. They have told me I am suffering from chronic ovaritis. But see, sir, I am feeling shivering, just cold sensation in my mammae. This single symptom, if you know this, you can straightly go to Cocculus and give him Cocculus 200 or 1M, and he will be cured within, say, 3-4 days. If you give 1M, it will be act nicely. If you get 200, it will get a bit more time. Lacan for ovaritis: heat feeling in ovarian and uterine region with menses. Inflammation of right ovary with extreme soreness and sensitiveness, so that every motion, every breathing becomes painful. Wants to lie with her knees to her chin. Knees and chin are same position. That is, it is called like dog-like bent. Burning in hands and feet, pain appears suddenly and goes suddenly. These peculiarities are shown in Lacan. Phosphorus for ovaritis: pain in region of left ovary moving down to inner side of left thigh. Pain ovary, back and abdomen during menses. Sterility from excessive voluptuousness. Patient suffers from leukorrhea with chlorosis. Sulfur for ovaritis: pain alternating with eyes and ovary. I have written it as USP. See, the particular person is suffering from ovaritis. His pain alternating with eyes and ovary. So it is certainly an uncommon, strange, peculiar symptom. Pains from ovarian region to back. Feeling of weakness in genital organ. Patients feeling hot, cannot keep clothes on. This general symptom of sulfur. Feel home when bare-bodied, like sweets, acid, alcohol, beer, milk. All body discharges are acrid and offensive. These are peculiarities of sulfur patients. Now with this, the video ends. Thanks for listening and viewing. If you got anything to say, please write it in the comment section. I would certainly respond.